whatever. Today we will discuss about the item number 4, that is the superficial muscles of the back scapular region. So let's start. The superficial muscles, which are located in the scapula, there are 6 muscles: deltoid, supraspinatus, infraspinatus, teres minor, teres major, and subscapularis. And these are called the intrinsic shoulder muscles. Now let's come to the deltoid. It is 3-in-1 muscle. It is thick, powerful, and curved triangular muscles which covers the shoulder and forming its rounded contour. If you see the lateral part of the shoulder, this muscle is situated and it forms the actual contour or shape of the shoulder. It has 3 parts: anterior part, which is inupinate, posterior part, which is also inupinate, and the middle multipinate part. Origin: it has a V-shaped origin. It's It is originated from the lateral one-third of the clavicle, acromion process, and crest of the spine of the scapula. Or if we say in details, the anterior inupinate part, it arises from the lateral third of the clavicle. Anterior border of the lateral third of the clavicle. The medial multipinate part, it arises from the lateral margin and upper surface of the acromion process of the scapula. And the posterior inupinate part, it arises from the lower lip of the crest of the spine of the scapula. Then insertion, it is inserted in the humerus. V-shaped deltoid tuberosity, which is located in the lateral aspect of the middle of the shaft of the humerus. So in the lateral part of the humerus, there is V-shaped deltoid tuberosity. Here the deltoid muscle is inserted. Now come to the nerve supply. The deltoid is supplied by the axillary nerve, that is C5 and C6. And then come to the action. The deltoid has 3 fibers: anterior, posterior, and medial fiber. The anterior fiber is the flexor and medial rotator of the arm, and the posterior fibers, these are the extensor and lateral rotators of the arm, and medial multipinate fibers are a strong abductor of the arm from 15° up to 90°. Okay, so there is a clinical condition regarding it. We frequently give intramuscular injection for any clinical purpose. So what is the actual site of giving this injection? Look at that. The intramuscular injections are commonly given in the lower half of the deltoid. In the lower half of the deltoid, to avoid injury to the axillary nerve. And we know that the axillary nerve, which winds around the surgical neck of the humerus. So if we give the intramuscular injection in the upper part, there is a frequent chance of injury to the axillary nerve. So the intramuscular injection is given in the lower half of the deltoid. Now let's see how the muscle looks like. Yes, this is the deltoid. So you can see this is the anterior fiber, this is the medial fiber, and this is the posterior fiber. The anterior fiber is originating from the lateral half of the lateral one-third of the clavicle. Then medial fiber is arising from the acromion process, and the posterior fiber is arising from the scapula, rest of the spine of the scapula. And they are inserted in the lateral aspect of the humerus. There is a V-shaped deltoid tuberosity. This V-shaped deltoid tuberosity is the insertion point of the deltoid. Okay. So this is a side view of the deltoid muscle. So these are the anterior fiber, this is the posterior fiber, and this is the middle multipinate fiber or middle fiber. Okay, and they're inserted in the deltoid tuberosity of the humerus. Now come to the next muscle. This is the supraspinatus. Supraspinatus is originated from the medial two-third of the supraspinous fossa of the scapula. You know, in the scapula, in the posterior surface, there is a spine or crest, and above the spine, the area is called supraspinous area. So from the supraspinous fossa, it arises. Then insertion, it is inserted on the superior facet or upper part on the greater tubercle of the humerus. And nerve supply is related to the name of the muscle, that is the suprascapular nerve, root below C5, C6. In action, it initiates the abduction of the shoulder, and it is responsible for the first 15-degree abduction of the shoulder. Okay, so you can say from 0 to 15 degree, the abduction of the shoulder joint is by the supraspinatus, and from 15 degree up to 90 degree, the abduction is done by the deltoid muscle. Okay, so let's see how does it look like. So let's see how does it look like the supraspinatus. So this is the supraspinous fossa. This is the scapula. This is the posterior surface. This is the supraspinous fossa, and we can see this from this supraspinous fossa, the supraspinatus muscle arises, and it is inserted in the superior facet of the greater tubercle of the humerus. Next muscle, there is the infraspinatus muscle. Okay, it arises from the medial two-third of the infraspinous fossa on the posterior surface of the scapula, and it is inserted just posterior to the supraspinatus. So that is the medial facet of the greater tubercle of the humerus. And nerve supply is the same as the supraspinatus. This is a suprascapular nerve. C5 and C6 is the root value, and action is the lateral rotation of the humerus. Okay, so let's see how does it look like the infraspinatus. Look at that. This is the infraspinous fossa. So this muscle arises from this fossa, and it is inserted in the medial facet of the greater tubercle of the humerus. Our next muscle is teres minor. It is originated from the posterior aspect of the lateral border of the scapula, and it is inserted in the lower facet of the greater tubercle of the humerus. And nerve supply is the axillary nerve, root below C5, C6, and it also acts as a lateral rotator of the humerus. Now let's see how does it look like. This is the teres minor muscle. It is originating from the posterior surface of the scapula on its lateral border. Okay, we can say in the upper two-third of the lateral border of the posterior surface of the scapula, it is originating, and it is inserted in the lower facet of the greater tubercle of humerus. Now come to our next muscle. This is the teres major muscle. It is originated from the dorsal surface of the inferior angle and adjoining some lateral border of the scapula. It is inserting in the medial lip of the intertubercular sulcus of humerus. Sorry, and then the nerve supply is the lower subscapular nerve. The root below is C5, C6, and C7. And action is the medial rotation of the arm. So, so you can see this is the teres major muscle. So it is mainly originating from the part of the lateral border and inferior angle of the scapula on the posterior aspect, and it is inserted on the intertubercular sulcus, medial lip of the intertubercular sulcus. Then come to the next muscle, subscapularis. It is originating from the medial two-third of the costal surface of the scapula, that means anterior surface of the scapula, and it is inserted in the lesser tubercle of the humerus, and nerve supply is the upper and lower subscapular nerve, root value is C5 C6, and action is the medial rotation of the humerus or arm. So let's see how does it look like. So this is the subscapularis muscle. This is the anterior surface of the or costal surface of the scapula. So from the costal surface or anterior surface, this muscle is originating and it is inserted on the lesser tubercle of the humerus. Okay, lesser tubercle of the humerus. Now come to the rotator cuff muscles. We already discussed in first class. This is the what are the muscles of the rotator cuff. There are four muscles together called the rotator cuff. These are the supraspinatus, infraspinatus, teres minor, and subscapularis. These four muscles are called rotator cuff muscles, and or another name is musculotendinous cuff or rotator cuff. So we can remember this by a there is the sets supraspinatus, infraspinatus, teres minor, and subscapularis. These four muscles together called rotator cuff muscle. So if we say what is the main function of this rotator cuff muscle, in one word, you can say it stabilizes or strengthen the shoulder joint. Why? Because the it is a ball and socket type of joint. The shoulder joint is, and the ball is larger, but the socket is smaller. So we have to stabilize the joint. So this rotator cuff muscle, this stabilizes or strengthen the joint. So we can see the rotator cuff plays an important role in stabilizing the shoulder joint, and its primary function is to grasp the relatively large head of the humerus and hold it against the smaller, shallow glenoid cavity. So this is the function of rotator cuff muscle. So you can see in a cross section. So these are the greater tubercle, supraspinatus, infraspinatus, teres, and from the lesser tubercle there is the subscapularis muscle. Subscapularis muscle. So these four muscles together they strengthen the shoulder joint. Let's learn about some terminology. Uh, these are the protraction. What is protraction and what is retraction? Protraction means any forward movement of the any part, and retraction means backward movement. And shrugging, the shrugging term is the synonym of elevation. So if there is any elevated part of any bones or joint or any muscle, we can say there is shrugging. Forward movement, protraction, backward movement, retraction, and elevation is shrug. So there is a chart from the wisdom sink. It is showing the which are the muscles that causes protraction, retraction, elevation, depression, and medial lateral rotation of the scapula. So you have to know which muscles causes which type of movement, or in short, you can remember the function of each and individual muscles, so that it will be more easier. So in the second part, we will talk about the muscles of the back, that means muscles connecting the scapula with the vertebral column. So there are arranged in two layers, superficial layer and deep layer. The superficial layer, there are two muscles, trapezius and latissimus dorsi, and the deep layer, there are three muscles, levator scapulae, rhomboidus major and rhomboidus minor. So let's come to the trapezius muscle. It is a very big muscle. It is a flat triangular muscle, and the muscles of two sides, that means from left side and right side, when uh, they side by side in the midline, we can see it looks like a diamond shape or trapezoid shape. Hence the name is trapezius. Okay, if it is the midline, so the trapezius muscle looks like this on the right side, and on the left side look like this. The shape is almost diamond shape or trapezoid shape. So this is so that is why it is called trapezius muscle. Now let's see the origin of the trapezius muscle. It is originating from the middle third of the superior nuchal line, external occipital protuberance, ligamentum nuchae, and spine of the cervical 7 vertebra, and all the spine of thoracic vertebra. That means thoracic 1 to thoracic 12 vertebra. Okay. Now let's see the insertion. Where it is inserted? It is inserted by three fibers: superior, medial, and lower fiber. Superior fiber is inserted in the posterior border of the lateral one third of the clavicle. The medial fiber is inserted in the medial margin of the acromion process and upper lip of the crest of the spine of scapula. And lower fibers, it is also inserted in the scapula, in the medial and middle third of the spine of the scapula. Or you can show say short in the spine of the scapula. The nerve supply, it has motor supply and sensory supply. The motor supply is provided by the 11th cranial nerve. This is the spinal part of the accessory nerve. You know there are 12 pairs of a cranial nerve. Among them, the number 11 cranial nerves, it supplies trapezius, and its sensory supplies via ventral lamina of the cervical 3 and cervical 4 spinal nerve. Let's see the actions. The upper fibers, trapezius, along with the levator scapulae, it elevates the scapula, as in the shrugging of the shoulder. That means elevation means shrugging. When we elevate our shoulder, the upper fiber of the trapezius helps us, and the middle fibers of the trapezius, it retract the scapula, as in the brushing back in the shoulder. And the lower fibers, it is the lowermost fiber, it depresses the scapula. And these trapezius muscles helps in the abduction of the shoulder. With the help of serratus anterior, this muscle helps us to abduction of our arm beyond 90 degree. Okay, so we can say the abduction of the shoulder joint or arm from 0 to 15 degree, it is by supraspinatus muscle. From 15 degree to 90 degree, it is by deltoid muscle. We have already read. And beyond 90 degree, the abduction is done by the trapezius as well as serratus anterior. So let's see how does it look like, the trapezius. Look, this is the trapezius muscle. Okay, so this is the outline of trapezius muscle. So it's originating from the external occipital protuberance, middle one third of the superior nuchal line, ligamentum nuchae. It's a ligament that connecting the skull with the vertebra and spine of the cervical 7 vertebra, as well as the spine of the all thoracic vertebra. That means from thoracic 1 to thoracic 12. And this external occipital protuberance and medial one third of the superior nuchal line, it is located on the occipital bone on the skull. And look at that, it is inserted by three fiber: upper, medial fiber, and lower fiber. And it is inserted in the posterior surface of the lateral one third of the clavicle, as well as the acromion process and upper crest of the spine of the scapula. Now, our next muscle is the Latissimus dorsi. Okay, so Latissimus dorsi, it is a wide, flat, triangular muscles on the back. It is mostly superficial. Okay, so let's see the origin. It is originated from the lower six thoracic vertebra. That means from thoracic 7 to thoracic 12 vertebra, it is originated, and posterior lamina of the thoracolumbar fascia. That means some fibers coming from the lumbar region, and as well as the outer lip of the iliac crest. This is a bone, hip part of a hip bone or pelvis, and lower 3 or 4 ribs and inferior angle of the scapula. That means it is a huge muscles. It is originated from the scapula as well as the lumbar region and the iliac crest. from the pelvis, and it is inserted in the floor of the intertubercular sulcus of the humerus. You know the humerus, there is a septal group or intertubercular sulcus. In the floor, it is inserted. The nerve supply is the thoracodorsal nerve, and it is arranged in the posterior part of the brachial plexus. You can say its another name is nerve to the latissimus dorsi. What is the action? The action is adduction, extension, and medial rotation of the humerus. Adduction, extension, and medial rotation of the humerus, as well as it helps in climbing and walking and in violent expiratory force. Climbing, walking, swimming, this kind of exercise, we use this muscle latissimus dorsi. So let's see how does it look like. So this is the latissimus dorsi. Okay, so you can see this muscle is extended up to the pelvis or sacrum. So these are the originating point. Lower 6 thoracic vertebrae, that means thoracic 7 to thoracic 12, as well as some fibers coming from the thoracolumbar fascia, and look at that, some part is coming from the iliac crest, and ultimately, and some part is coming from the inferior angle of the scapula, and ultimately they are inserting to the floor of the intertubercular sulcus. Okay, now our next muscle is the levator scapulae. It is originated from the transverse process of the atlas and axis vertebra. That means cervical 1 and cervical 2 vertebra, and the posterior tubercle of the transverse process of the third and fourth cervical vertebra. So we can say, in short, the tubercles, or we can say the transverse process. The transverse process of the cervical 1 to cervical 4 vertebra. In short, and they are inserted in the this levator scapulae is inserted in the scapula upper part, in the medial border, upper part of the medial border of the scapula. It is inserted, and nerve supply is the cervical 3 and cervical 4 spinal nerves, as well as the C5 spinal nerve. Look at that, it is originating from the cervical 1 to cervical 4, the transverse process of the cervical 1 and cervical 4 vertebra, and nerve supply is similar to that. Look at that, cervical 3 and cervical 4 spinal nerve, and as well as some part is coming from the cervical 5. And its action is the elevation and steady the scapula during movement of the arm. So let's see how does it look like. So this is the levator scapulae muscle. Look at that, it is arising from the transverse process of the cervical 1 to cervical 4 vertebra, and it is inserting in the medial border, upper part of the medial border of the scapula. This is the levator scapulae. Now our next muscle is rhomboidus minor. The rhomboidus minor, it originating from the lower part of the ligamentum nuchae, and as well as the spine of the cervical 7 and thoracic 1 vertebra, and it is inserting in the base of the triangular area at the root of the spine of the scapula, and its nerve supply in action is similar to the rhomboidus major. So we will study these two muscles together, then come to the rhomboidus major. So rhomboidus major, it's originating from the spine of the thoracic 2, 3, 4, 5 vertebra, and their supraspinatus ligament, and inserting in the medial border of the scapula between the root of the spine and inferior angle of the scapula. Nerve supply, both rhomboidus major and minor, supplied by the dorsal scapular nerve, that is the C5 root valve, and action is to retraction of the scapula. So this is the rhomboidus minor. It is arising from the cervical 7 and thoracic 1, cervical 7 and thoracic 1 spine, and it is inserted on the root of the spine. Okay, on the medial border root of the spine of the scapula. And the rhomboideus major muscle, it is arising from the thoracic 2, thoracic 3, thoracic 4, and thoracic 5. 2, 3, 4, 5 thoracic vertebra, and this is inserting in the lower part of the medial border of the scapula. It's the rhomboideus major. And all these two muscles is supplied with the same nerve, and their same action is a retraction of the scapula. Is some space that is called triangle of auscultation. Okay, it has some clinical importance. So let's see what is triangle of auscultation. It is a small triangular area in the musculature of the back of the thorax near the inferior angle of the scapula. Okay, so it is a small triangular muscular gap. Okay, it is a gap on the back of the thorax, just near the inferior angle of the scapula. So let's see what is its boundary. It is formed by the superior horizontal border of the latissimus dorsi, medial border of the scapula, and inferior lateral border of the trapezius muscle. And the floor is formed by the floor is formed by the sixth and seventh ribs. So the space will be the sixth intercostal space. So what's its importance? Why is the importance of this triangular gap on the back of the thorax? This is uh, this is the importance is the when the scapula are drawn anteriorly by folding the arm across the chest. That means when we forward movement of the scapula is done and the trunk is flexed. Trunk means the thorax and abdomen together is called trunk. When we flex our trunk, this triangle will be enlarged and more subcutaneous. So what is the importance? The lower lobe of the lung can be ausculted by putting the stethoscope in this region. That means the lower lobe of the lung comes in very superficial position in this triangle, and so we can easily auscultate this region by stethoscope. So for auscultation purpose, this triangle is very important. So let's see this area. So this is the triangle of auscultation. This is the triangle of auscultation. This small triangular red area. This is the triangle of auscultation. So look at that. It is the border is formed by the lower border of the trapezius muscles, medial border of the scapula, and latissimus dorsi, upper border of the latissimus dorsi. So this there is a muscular triangular gap on the back of the thorax. So its important is for auscultation of the lower lobe of the lung because it becomes more subcutaneous and more superficial when the trunk is flexed.